Hello everyone, welcome to KAH Homeopathy Study Group Pro Bono Webinar. Good morning, good afternoon and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank universe for giving us this great opportunity. And Dr. Sweta Singh, our KAH Chief Administrator, will start the session.
Hello everyone, myself Dr. Shweta Singh, KAH Chief Administrator, welcomes our respected speakers, Chairman and CEO Dr. Kavita Kukunur ma'am, KAH volunteers and all the attendees to KAH webinar. I would like to take the opportunity to introduce KAH Homeopathy Study Group to all of you. KAH Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach, KAH. This study group is intended to be an offering from Kavita to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model are foundational principles for the KAH. KAH's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificate for spreading the light of homeopathy globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board credited, certified by Council for Homeopathic Certification (CHC) and Achina CPT provider, and serves as the associate editor for the Homeopathic Heritage. She is a recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga Raju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. TANA, Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhansin Rawat, Senior MLA Mr. Harbhajan Singh Cheema, Ex-Director Homeopathy, Government of Uttarakhand and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Dr. Deepak Sharma, Dr. Rajneesh Kumar Sharma, and myself, KAH team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavita was also honored by renowned DTA Detroit Telugu Association Executive Committee on Mother's Day at Michigan, USA, with DTA Community Service Award 2023. We are extremely happy and proud that we celebrated 12 years of her book, Beyond the Limits, A Challenge to Prove Oneself, and her second book, A Dose of Spirituality with Kavita, has also completed its 2 years. The ebook was launched last year in presence of Honorable guest of speakers, American Institute of Homeopathy AIH President Dr. Alex Becker and Council for Homeopathy CHC President Dr. Sheetal Tiwari at our KAH webinar. At KAH second annual celebration, our honorable guest of speaker Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1,500 to 10 to 15 charities, which we have also listed on the website. Dr. Kavita donated the proceedings of the book through KAH Homeopathy Study Group platform to various charitable organizations and homeopathic associations. To name a few are Kevin Friendly Foundation, CHC, DHMA, JSPS College, PT Seva, NCH, etc. Interested one can reach us for details at kastudygroup@gmail.com. As of now, we have nearly 400 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our YouTube channel with the name Kavita Kukuno. This webinar is moderated by myself and it is being recorded as we speak. We will take questions at the end of the webinar. We will also post jot form in Zoom webinar chat at the end of the webinar. So please fill the form to receive your certificate and kindly mute yourself and turn your video off for better connection. Let me introduce our honorable speakers to you all. Today we have with us Dr. Abhishek Subhash Wairkar and Dr. Nikhil Kambli. First, we will go with Dr. Abhishek, who is an MD homeopath and homeopathic physician with 14 years of clinical experience practicing in central Mumbai region. He is a medical examiner to Gokhale Education Society's primary and secondary school since past 6 years. He is a medical examiner to Mumbai University's Mr. and Miss University programs since past 2 years, and his topic will be on clinical cases, a simplistic approach. So welcome, Dr. Abhishek.
Thank you, ma'am.
Thank you for joining us at this platform, sir, and now you can proceed with your session.
Good evening, all. Good morning and good afternoon to my friends across the globe. Recording. So good evening to all, dear doctors. Let's begin with our topic. I'm Dr. Abhishek Subhash Wairkar. I'm MD in homeopathy. Today's webinar, rather than taking a lecture, I would prefer to share my direct experience of solving clinical cases to simplistic approach. So let's begin. There are various approaches of going to find an indicated remedy in a particular case. One such approach is considering only peculiar, characteristic, odd, strange combination of symptoms. Another approach is listing out all remedies which are present in a common general symptoms and then narrowing down the search to remedies which are present in a peculiar, rare, and strange group of symptoms. And another approach is selecting a remedy which are covering only a symptom phase or cross-sectional study of the patient, or selecting a remedy which is covering through and through all the symptoms which are present in entire life history of the patient. So let's begin with the first approach by considering only peculiar characteristics and rare symptoms. Let's take an example of the case. A 53-year-old married male complained of recurrent hiccups aggravated by drinking alcohol, aggravated by thinking about the complaint, and better by induced vomiting. Habit of alcohol for more than 30 years. Drinks 1 quarter at a time for at least 4 times a week. Hiccups started since past 5 to 6 months. Almost daily, remains for few hours for entire day. Since past 1.5 years, he is complaining of generalized weakness occasionally falls down while walking, and multiple joint pain, especially knee, tingling sensation of fingers and toes, aggravated during sleep, cramps in the calf muscle, and while stretching of limb, especially while lying down. He's thirsty, feels hungry, but loses all hunger as soon as he tries to eat something. He's angry policeman and he don't like to travel. In family history, his mother, hypertensive, father was having cancer of unknown origin, history of multiple swellings at external throat. So in entire history, what I could find is a strange combination of symptom, that is hiccups in alcoholic patient. So and his hiccups would aggravate by drinking alcohol. So in Kent repertory, hiccup in drunkards in and in thirsty patient, the only remedy I could find is ranunculus bulbosus. Boric writes about ranunculus bulbosus as bad effects of alcohol, delirium tremens, spasmodic hiccups. So in January 1824, I have given the remedy ranunculus bulbosus 200, one dose. In February 22, just after 1 month, actually patient didn't turn up. His wife came to show the follow-up, for the follow-up. His hiccups better, but whenever he drinks hiccup, his hiccups aggravated, but in lesser frequency and intensity as compared to earlier. His weakness and tingling numbness in extremities got better. So in this case, instead of considering entire totality, the approach was to consider only a peculiar symptom. Let's take an example of another case. 74-year-old female, history of schizophrenia since past 7-8 years. Actually, she was admitted in a mental asylum by her son in February 2023 for 10 to 15 days. But she was tied to bed and she was in vegetative state, lying on bed all the time. Seeing her condition in hospital, her son decided to bring her home and stop all allopathic medications. On 27th of March 23, her son, who happens to be my patient, came to me and uh, told me that you take the history and you take up the case. I don't want to start any other medication. So whatever history provided by son and on video recording my observation, I gave the remedy. Son gave me the history, like she became very suspicious, removed everyone from house, used to stay in dark. For this past 7 to 8 years, her nature, uh, she used to talk alone, don't used to sleep for days together. Even so much of suspiciousness that she removed her caretaker and eat food only if it is provided by son. She became very aggressive, used to bang her hands on wall, shout loudly, keeps eyes closed most of the time. Her salivation increase till someone beat her legs with sticks, due to which she is unable to walk. She was lying most of the time. She was lying on the bed. She was unable to talk or walk. She had a fear of walking because um, uh, she was in throughout her life. She was very dominating person. So symptoms on this record, what I could get is suspiciousness, salivation increase, eyes closed, desire to anger, violent, and dictatorial. I've given the medicine belladonna 1 m, 3 pills 3 times a day. Nearly after 1 month, on 26th of April, her walking improved to great extent. Now she started walking. Also, to mention that she did not had a control over stool and urine. So in on 26 follow-up, she could even that time she did not had a voluntary control over stool and urine. Her suspiciousness has reduced, and on 22nd of June, she got a good control on stool and urine. Now she can stand and walk alone. Her suspiciousness reduce, her hallucinations reduce, and for past 1.5 month, she didn't sleep for 2 to 3 days at a stage, and after that she got after this insomnia, she used to become irritable. And the last follow-up was on 3rd of February 24, in which her hallucinations reduced to great extent. She could walk and stand, got good control over stool and urine. Her suspicious nature reduced. Uh, Means initially what I did, I have repeated belladonna frequently, but once the reaction started in favorable manner, I have stopped giving the medicine and kept the patient on the placebo. In these both cases, the most important thing is I have prescribed only on this particular strange group of symptoms, and not considering entire general group of symptoms. So when we pick up odd, strange, and peculiar symptoms, it requires a great power of observation, ability to pick peculiarities and discrimination between the symptoms, and knowledge of materia medica. So it comes with the practice and experience. Another way, but more basic and more advisable to everyone, is uh, we go from the general to peculiar symptom. General means common. So first we list out all the remedies which are present in generalities, and then choose one which is having peculiarities in the case. This approach is more comprehensive approach, and this is suggested by Dr. C.M. Boger for all the practitioner who are neophytes in their practice. It is quite laborious task, and but chances of missing out any remedy is minimal as compared to the earlier approach where we consider only peculiar, strange, or characteristic symptoms. So let's take up the case which we go from the general symptoms to peculiar symptoms. 33-year-old female with a complaint of recurrent intolerable headache for past 6 years. Headache used to begin from right periorbital region and spread to right temporal region. Used to increase after looking at artificial light. She became aggressive, loud, as she all the time busy in her household work. She is having all work-related states, stress. She has a habit of taking over-the-counter medicines, that is tablet Saridon, and applying Vicks for relief. She wanted a peaceful life for self, prefers to sit alone, watch TV serials, or do religious chanting, meditation, but was struggling to find time for herself. Her headache started 1 month after the birth of first child, and which remained for 4 years and aggravated in frequency and intensity after the birth of second child. That is since past 2 years. Subjective weakness of memory since past 1 year. See, we are listing all the complaints one by one. She is a patient of multiple complaints at multiple time. Hair fall increase since past 3 to 4 months. Recurrent left-sided inguinal region pain while sitting since past 2 months. Pain 4 to 5 times a day and usually lasts for 5 minutes and then subsides. Stool urine normal. She is also complaining of itching of eyes with increased lacrimation since past 15 days. Bilateral leg pitting edema since past 10 days. In her personal history, she has a craving of sweets. Her skin is very cold to touch, and she's putting on weight. Her father was diabetic, mother, the paternal grandmother diabetes, and breast cancer. Maternal grandfather oral cancer. So in this more comprehensive approach, first what I have done, I have, as suggested by Dr. C.M. Boger, I have listed out all the medicines which is quite good in number, which covering all the general symptoms like memory weak, tired, worn out, itching eyes, lacrimation, hair fall. And then I have narrowed down my search towards finding an indicated remedy by considering very few group of characteristic peculiar symptoms. So headache aggravated by artificial light, desire sweets and skin cold to touch. In this search, by narrowing down, apart means from the group of all these remedies, I came on two remedies, sepia and natrum car. And the sepia is the only remedy which covers right-sided headache. So obvious choice was sepia. On 15 January, the sepia, she received a dose of sepia 200. 3rd February, no headache, itching eyes and lacrimation reduce, weakness reduce but not completely reduce. She is better in her anger, hair fall no change, pitting edema lower limb better. On 27th February, no headache, itching and lacrimation eyes better, weakness better, anger better, hair fall better, pitting edema lower limb better. So when we differentiate these two approaches, we find that considering this approach is much more better because it is chances of missing out any remedy is minimum. In earlier days of my practice, when I didn't had a computer or a repertory for nearly 4 to 5 years, so what I used to do, I used to write down all the symptoms, and then I used to list out the remedies which are present in front of those symptoms, and then finally narrow down my search by uh, through a very peculiar and characteristic symptoms. So this is a very good approach when for especially for the people who are new in their practice. Even though we are away from the remedy in our first prescription, it is there are more chances that finding out an indicated remedy by further evaluation of the cases in subsequent follow-ups. Let's take another approach. The another approach, as suggested by Dr. C.M. Boger, the one way is prescribing for the symptoms of phase, that is phasic symptom. That is, we pick up from the presenting symptom totality which are striking and unusual in feature. Some people call it cross-sectional studies. And other way is pick up from life history striking unusual features which crop out and stick to the patient through many forms of sickness, and then to find their counterpart within the pathogenesis of some remedy. So these two approach we consider, if we consider the most comprehensive is going through life history of patient and then finding out the various symptoms, listing out the various symptoms which are present in various phases of the life history, and then considering the symptoms which are which crops out through and through at various phases, or considering the symptoms which are very peculiar at various phases of the life history. So there are various pros and cons of each of these approach. Let's take a first approach with an example of the case. 53-year-old male, he complaining of vertigo since past 1.5 months. Vertigo while descending from steps, rising from seats, and lying on back. Generalized increase in thirst, but appetite markedly reduced. So in this phase, I just had a phasic symptomatology of this patient, and on that, by considering these symptoms like vertigo rising from seat, vertigo descending stairs, lying on back, appetite diminished, thirst increase, I've arrived at two remedies. One is Conaim. In Conaim, the vertigo aggravates by slight noise. Even while giving history, the noise is unbearable to patient. So even conversation of others is aggravates the vertigo. And in Muxol, the vertigo aggravated by lying on back, and there is band lying feeling around the head. So the obvious choice was the Muxol. So he received Muxol 201 dose, and after 15 days of follow-up, his vertigo was much better, but again started since past 5 days. In between, I have done his MRI because to rule out if there is any local pathology. So initially the vertigo was better with the 201 dose of Muxol, but again the symptom came back as it is. So I have repeated 200 dose in deviated form. Deviated dose is like we try to prepare something called 201, and it is slightly deviated from the previous potency because the symptoms came back again after giving initial relief to the patient. So no point in going to same dose and potency. And then on 20 November, the Vitago completely better. Let's take another example of prescribing on phasic symptom. Baby RD, 2 months old male. Actually, this case, reason behind presenting this case, that I was very dicey whether to go forward with this case or no, because this baby was having congenital heart disease, like that is dextrotransposition of great arteries, ventricular septal defect, atrial septal defect. My clinic is very near to KM Hospital, where there are a lot of trust present, and this trust provides shelter to the patient who are coming from far away to for treatment to KM Wadia and Tata Hospital. So this baby is under evaluation and planned surgery in couple of months for his congenital heart disease. But suddenly he developed uh, acute cough, and which is aggravated at night, and for which he received antibiotic drops, augmentin from pediatrician from KM Hospital, but there was no significant relief. So considering my clinic is just adjacent to that trust shelter, they brought that patient to me. At, and also to mention, there was baby was losing weight because of the acute infection. So my aim is to just relieve cough and stress. So I took these rubrics on whatever I could get in 2 months old baby. Sensation and complaints, cyanosis, blue face, which is aggravated by weeping, generality, children, infant, cough, aggravated night. So there was a two remedies, belladonna and antin-tard. Considering sudden onset of the complaint, I have selected belladonna. Belladonna 200 was given in mother's milk because 2 month old baby on 13th of November and 14th November, the cough better. He got good sleep at night. But later on, I didn't really know what happened to that baby because he was having, there was a planned surgery in KM Hospital. Another case where prescribing on phasic symptoms, 37-year-old female with 37 weeks pregnant with a complaint of fever with chills and weakness and cough. On evaluation, diagnosed as falciparum malaria with platelet 72,000. She was immediately admitted in hospital and treated with IV fluids and antimalarials. During the course of treatment in hospital, her fever improved but weakness continued. Cough aggravated by little movement with right-sided chest pain and on inspiration. Without repatriation, she received a dose of Bryonia 200 because what is standing out in this case was cough. In falciparum malaria, why there would be a cough which is aggravated by little movement. Even on the bed of hospital, she used to turn, the cough used to aggravate. So she received a dose. And within few hours, her cough improved and right-sided chest pain reduced. On 22nd, she delivered a baby boy who developed mild hypoxia, for which he was kept in NICU for observation and further evaluation, and discharged on day 5 after complete healthy condition. So from these three cases, whenever we prescribe for this symptom phase, it is always we consider it is cure, but it is not a cure. It is never cure. This shifty prescribing is deceptive. We should reserve to all emergency cases and quite few other cases, like what case I had of that little baby, where I had no choice but to prescribe. And these are corrective in applications, like to take out the patient from that state. It never covers entire totality, but in few occasions, when you prescribe for that phasic phase, there is a chance that it covers through and through life history. That same remedy covers through and through life history of the patient, but that is a very rare chance. But we try to usually avoid and limit this prescribe on phasic symptoms to few cases only. The more ideal is picking from life history the striking, unusual feature which crop out and stick to the patient through many forms of sickness, and then finding their counterpart in materia medica. Because this kind of, when we have this kind of approach, a remedy has a power to cure radically, but it yields better result, and but it requires time and patience, because your history and every, you have to consider everything right from the beginning to till date, all the symptom phase, and then what are the characteristic symptoms which are which are present in every symptom phase. Also, what are the symptoms which are coming up, which are uh, constant in various symptom phase. So this, which we, when we prescribe on this, then there are chances of better results, and we don't have to you know when we are very sure of our prescription. uh, let's see. So life history, prescribe considering life history. So there are symptom phase, like one symptom phase, then second symptom phase, third symptom phase. We consider this symptom phase. We take the characteristic from each phase, or which we find out the common symptoms of symptoms which occur most of the time in this symptom phase, and then we consider a grand totality and then find their counterpart in our materia medica. That is more ideal and that is more radical way. And this is the exact way which is described by Dr. C.M. Boger in his collected writings through various cases. So let's go back to the previous case where I had prescribed on the symptom phase. So where did I went wrong? So reason behind showing this case, that we always learn from the mistakes. So whatever mistake I have done by prescribing on symptom phase, I should correct in the future. So what went wrong? See, this case, the same case of falciparum malaria, where she received bryonia. In her follow-ups on 12th of October, she was complaining of bright red bleeding for 2 days and with cough and expectoration. She received phosphorus 201 dose. Then on 31st May, copious leukorrhea, vomiting during menses, pain in abdomen and hyperacidity. She received Veratramal. On 22nd July, acute fever with cough, she received Epicac. On 29th 9, acute cough, aggravated movement, right-sided chest pain. Again, similar kind of symptoms. So she received bryonia. On 25th Jan 23, acute cold with headache, frequent menses. In throughout her life history, she's been complaining of frequent menses. She received Peramed. On 7th of Feb, acute cough, lying down, aggravation, after cold, aggravation movement, and menstruation early and bright red. So if you consider all these things, what mistake I have done, every time, most of the time in during the follow-up, I used to consider the phasic symptoms, whatever characteristic I found at that moment of time, and I used to prescribe on those phasic symptoms. But every time my remedy is different. So patient is better, I feel happy, I felt happy. It is better, but no cure. So going through these cases during evaluation, I found this mistake. What I have done, I should have gone through the all life history of the patient, considering previous complaint, present complaint, various complaints during symptom phase, and find a grand totality and prescribe find a remedy which is covering all those grand totality. So what I did in this case, uh, I found the symptoms which were consistencies in when I went through the record. I found the symptoms which are consistent in most of the time. That cough, whatever may be the diagnosis, that these were the symptoms which were cropping out from this diagnosis. Whether it is malaria, whether it is GI infection, whether it is respiratory infection, the cough, slight movement, chest pain by inspiration, cough, draft of cold air, cough lying down, profuse fluent expectoration, menstruation too early, menstruation bright red. So these were the common symptoms which were present in totality, grand totality. And I have given the last remedy she received was a belladonna single dose. Let's see the follow-up by considering all this thing, all by covering grand totality. I don't have a follow-up because it is recently workout case. But reason behind showing this is uh, the more accurate prescription is going through entire life history, finding out symptoms covering through and through, rather than prescribing on the uh, phasic symptomatology. So let's take an example of striking unusual features from life of his life history of an individual case. Me, 20-year-old female student of occupational therapy. She had a complaint of irregular menses, copious menstruation, bright red bleeding. Her cycle used to range from 40 to 45 days. And since past 1.5 year, and since past 6 months, cycle varies from 30 to 45 days. Whenever she was in used to be in stressful period, her cycle used to become 45 days. And whenever she is in relaxed state, her cycle usually of 30 days. And her menstrual bleeding used to last from 3 to 7 days with 2 days of copious bleeding. Multiple times, since she is doing occupational therapy in government college, she multiple times she had done her USG pelvis, and during which uh, every time it showed a hemorrhagic cyst on any one side of the ovary in the cyclic phase, in the cycle of the month. So, and again, pain in the lower abdomen, lumbar regions, 1 day before menses, acne before menses, no history of hirsutism or acanthosis. Her last menses was 29/9/2022. Another complaint she came with was spontaneous ecchymosis patches on her bilateral lower limbs, uh, at least once in a month or 2 months. And she did all evaluation, all BT, CT, PA, PTINR, nothing abnormal was detected. And sudden in history, past history, there was 8 years back, there was sudden abdominal pain with vomiting. On evaluation, detected left renal calculi. And since past 6 years, there was a 4 episode of acute anxiety or panic attack. Uh, the complaint was profuse perspiration, difficulty in breathing due to emotional stress, as she experienced frequent quarrel between the parents. In family history, mother migraine and vertigo, paternal grandfather psoriasis. So if we consider through and through history of this patient, what is more common is hemorrhagic tendency. What Dr. C.M. Boger says is a pathological general. Ecchymosis spot, even bleeding, copious menstrual bleeding, or even hemorrhagic cyst on the ovary. So these are all hemorrhagic tendencies. So we consider Before that, she is mild, sensitive if anything happens to the father, emotional, good at drawing, but that is because of her father, because father is a VFX supervisor. She likes to be with people, but takes time to initiate talk with unknown people, thirstless and sensitive to cold in general. So through and through this case, considering entire life history, the most important symptom I found was a tendency, that is a pathological general. So hemorrhagic tendency, then menstruation, bright red bleeding, and before menses, the concomitant, that skin eruptions, then thirstlessness, mild and sympathetic. The remedy she received was the phosphorus. And during first follow-up, there was not much change. Uh, left left kidney upper polar calculi, right ovary hemorrhagic cyst. There was not much change. But in next follow-up, there was no ecchymosis on the skin for 2 months. This follow-up is after 5 months. So in that 5 months, for past 2 months, there was no ecchymosis spot on the skin. But she was having, when she came for the follow-up, she was having severe itching and burning in the urethra while passing urine. So acute urinary tract infection, for which I have repeated the dose, but in one step higher potency, that is in phosphorus in 1 m potency. And then there was so many follow-ups. It is very difficult for me to show all the follow-ups during this short period of time. I'm just showing the last follow-up. The menstrual flow moderate, the copious bleeding reduced to moderate for 5 to 6 days. No ecchymosis since the earlier follow-up. Since she started treatment, she started treatment 2 to 3 months later, her ecchymosis spots went off and she didn't experience it all afterwards. And since June 2023, there was no ovarian hemorrhagic cyst. So all clinically she is better. Plus on evaluation on sonography pelvis also she is showing improvement. These are her reports. If you can see, on March 23, there was left renal calculi and right ovarian hemorrhagic cyst I described above. Right ovary 2.6 into 1.2 centimeter big hemorrhagic cyst. And if you see a subsequent, I have a many follow-up USG, but if it due to the space, I have shown only 3. On June, there is no significant abnormality noted, and recent sonography left bulky ovary view with few peripherally arranged follicles. There is no hemorrhagic cyst present in this. So if we go back, so take home message is, we have seen 4 types of approach in the case. In first approach, that is considering only peculiar, even not considering any general. So that approach is mainly suggested when you grow up in the practice. Even now I feel I should consider general, jot down all the remedies which are present in general, and then go back to peculiar cases. And then select the remedies from, narrow down the list of remedies to peculiar cases. So that is one of the ideal way. Another approach is where we consider only phasic symptomatology. We consider, this is ideal one. List down all the remedies and then find out which is present in the peculiar case. Another approach would be consider only cross-sectional studies, that is a phasic remedy, and prescribe on that. But I have told you earlier the mistakes which I did in my practice by considering phasic remedy. Every time the patient used to come in the follow-up, I used to prescribe a different remedy. And patient was in delusion that patient is getting better. I am happy that patient is getting relief for the phasic symptomatology. But there is no real improvement. So that is a deceptive. That should restricted only to emergency cases and to certain cases where you have a limited role to play. If you go on doing this again and again, Dr. C.M. Boger says this is more harmful to the patient. You are doing more harm to the patient by just by just changing your prescription every time the patient comes to you. So that is not advisable. And most accurate, if you consider most accurate way of approaching towards particular case is considering life history through and through, considering physics, every phase of the sickness, and then prescribe an entire grand totality. Most important amongst those symptoms are which occurs most of the time in phasic symptoms or acute sickness, irrespective of diagnosis, which crop out, which points out, the patient or the symptoms will tell you, no, I want to get corrected. Please prescribe on me. So symptoms will crop out. So you need to have that ability or ability to discriminate which is require more attention. So symptoms which crop out in that different form of phasic symptoms, you have to note down those symptoms only, which are consistent, which are common, which are coming in most of the time. And in in order of importance are the symptoms which are peculiar, rare, characteristic at each phasic symptoms. So if we have for example symptom phase 1, then after 7 years patient present to you with symptom phase 2. After 2 years patient present to you symptom phase 3. So in each symptom phase, uh, if patient gives you certain characteristic, so you have to note down those characteristic. Then second phase note down characteristic. Then third phase note down those characteristic and form the grand totality and find out the remedy which is presenting or which is covering that entire grand totality. So that is a most accurate way of prescribing, and that will exactly what our masters want to tell us. And that exactly what I have did in this patient. The symptoms which are cropping out through and through these two patients. One the earlier which where I have did a mistake by prescribing on just one phase. I had no choice but to prescribe whatever I had that moment of time. But later on during follow-up, I should have corrected my mistakes. But later on in recently when I have jotted down all the symptoms, I have noticed or I made a mistake, and there was I should have write down or I should have studied entire case in this fashion. So in these two cases, I have studied through and through life history of patient and the symptoms which are most characteristics on which I formed a grand totality and prescribe on that. So thank you so much for your patience listening.
Thank you so much, sir. It was quite unique and wonderful. And we will take the questions at the end of the webinar. Now, I would like to invite our second speaker, Dr. Nikhil Kambli, sir, who is associated with us as KAH volunteer, and he is practicing homeopathy since 20 years. He'll be speaking on homeopathic learning through the masters, Dr. Boger. So welcome, Dr. Nikhil.
Hello, good evening to you, all of you, and good morning. We'll
now you
start.
can proceed with your sessions. So yeah.
Oh, is my screen visible?
Yes.
This is a disclaimer, and that all KHA study group webinars are for educational purposes only and not intended to diagnose or treat a disease. Listeners can benefit with the information shared at the webinars. The opinions expressed by speakers, moderators, and attendees are a part of an educational experience and do not necessarily represent the position of the Kavita Holistic Approach, KHA or KHA Homeopathic Study. This is both of us, me and Dr. Abhishek. And my topic is basically about homeopathic learning and through the masters. And I've specifically chosen Dr. C.M. Boger. I'm grateful to KHA for this opportunity to speak at this platform. And it's a wonderful experience being with KHA. Okay. So basically, first, I will like you um, uh, people to know something about myself. I'm Dr. Nikhil Kambli. I'm a medical practitioner with complete focus on homeopathy. And I've been practicing for nearly 20 years. I'm a KHA volunteer and a lot of many things. But the most important is that through 20 years, I have been through talking to, attending uh, talks on various homeopaths, attending various homeopathy webinars, listening, reading, and it was one of the most wonderful journey. Okay, and so basically, I would like to first start with a read something I read somewhere. Basically, the failure to think clearly, or what experts call a cognitive error, is nothing but a systematic deviation from logic, from optional, rational, reasonable thought and behavior. By systemic, I mean these are not occasional errors in our judgment, but routine mistakes, barriers to logic, we stumble over time and again, repeating patterns through generations and even through centuries. This is from the art of book called as Art of Thinking Clearly, Rolf Tobel. Now, what I've realized over the years is that the more you step away and look at homeopathy from outside, you get a clearer understanding of homeopathy. So basically, let me bring this quote to homeopathy. So basically, most of the time approach, I will speak of the most common approaches by most prescribers. It starts with aphorism number 6, where during our first year itself, we are told that we should be unprejudiced, well aware of the futility of transcendental speculations, etc., 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 the whole aphorism. So the first question that I asked myself, how does one become biased? So how does the observer become biased or prejudiced? If you notice, prejudiced is a word that is derived from two words, pre and judiciary. So you're already judging someone even before. So prejudiced. So how does one observer become prejudiced or biased? Well, biases actually start from childhood. And with regards to homeopathic learning, they develop whilst in college and later on while learning. Okay, I'll speak about some of the biases that are already there in all of us as practicing with the homeopathic journey. First is outcome bias, is that we subject ourselves to outcome bias when we judge the decision by the outcome, especially when random external factors play a role. So we say so and so, a lot of homeopaths I've heard, and a lot of people, including myself, so and so remedy cured because so and so case, without even considering there might be external factors at play. This is important because what happens later on when the same patient comes again, we find that the remedy is not useful or it doesn't ameliorate the patient. Second bias, which we introduced ourselves, that we look at a person's life situation through our limited experiences of life. Now, this is very important, is that when we listen to the life history of the patient, most of us tend to associate a lot of things which we have grown up with or which we haven't taught. So basically, one of the authors, Alfred Korzybski, an semantic scientist and philosopher, stated that map is not the territory. What does it mean? Is that when we grow up, we develop certain maps in our head that if so and so event occurs, so and so things should take place. But that is not the absolute truth. So all these things keep us away from actually understanding the real picture of the patient and what is to be seen in a particular case. The most common of the biases is something called as a story bias. And this all of us are subject to, because through our college education, later on we listen to a lot of things. We have read a lot of books. It comes with the personification of remedies or themes of materia medica that leads to story bias. Basically, even while talking to a patient, we subject ourselves to a story bias. So basically, we see a person telling so and so story about his life. We see that we are more interested in listening to the story. rather than getting the facts. Oh, grief, being portrayed as a victim of certain events in life. But our mind easily accepts stories rather than facts because facts are boring, stories are interesting. Example, we overlook the coercious nature of pulsatilla, most marked remedy in TPB. We wish to view pulsatilla as a mild BP lady, or we love to view phosphorus as a very outgoing, friendly person without even seeing the case on its merits. So this is something called a story bias, and this is very important in homeopathy because, again, I'm repeating, stories are dubious entities. They simplify things. They make us easy, but they distort reality and filter out things that don't fit. Means we won't want to believe that a person so and so behaving in a certain manner can do this. So it's easy for us to accept things as individuals. There are many more such biases: confirmation bias, availability bias. And the more you read about behavioral psychology and understand its biases, we continuously keep on subjecting ourselves to this. So my question comes, also the question is, how do we become unprejudiced? How do we become unbiased? So basically, that's why I've written awareness is half the battle won. First, we have to become aware of the bias. While ideally, while going through the life history of an individual, or while speaking to an individual, or while reading a materia medica, we should see whether we are subjecting ourselves to all these biases. It's very important. There are a lot of books available. The most common, most beautiful book I can think of is The Art of Thinking Clearly by Rolf Dobelli. He speaks about he basically speaks for investors, but we can actually take these biases and apply ourselves. That are we subjecting ourselves to any one of these biases, which will not enable us to understand the clear picture of what we need to do in that particular case. Aphorism number 3. Every case is different. So we have to, various biases will be applied to various cases. Now, why am I speaking to you all of this and what relation it has to do with understanding of masters? Because when we have difficulty or failure to understand in a case or what should be done, we should have a firm place to fall back on. We allow ourselves to again repeat the same thinking, creating the same output. A lot of reevaluation, a lot of history takings, and we again repeat the same process again and again. So when we do this again and again, we have to first understand that what mistake are we making. Second, masters roughly around the time of Hahnemann era and a century later who stamped their authority through their work, and which was backed by well-researched books backed by strong clinical practice. Books, materia, repertories were full of verified facts and not just a plethora of symptoms and rubrics. If you read the lot of articles by the masters or in the medical journals in 1800s, you will notice every symptom has been discussed upon, every characteristic symptom has been verified. So basically, how do we understand that? So basically, what helps us is basically the study of life history, books, articles. The most important thing, because there you will actually understand how the master thinks, how Dr. Kent or Dr. Boger or Dr. Bonninghausen approached the case. For Hahnemann, Dr. Bonninghausen, it is the lesser writings. So it will break a lot of biases which we have against it. It has done for me and it will do for you also. So basically, if we go back and we start learning through the masters in an era where everything was verified, it will give you a new outlook and a new approach to yourself first. It will break your biases. So you have to unlearn what we have learned and then start relearning again. So I was fortunate enough, I was fortunate enough in my practice to have an association with Dr. Praful Boger for 16 plus years, who introduced me to the works of Dr. Boger. The formation of something called as the LSMC, utilizing the LSMC format in clinical practice, what we learn in our college, or basically putting down the JOD of the patients and journey of disease of the patient, and how to look into clear facts and rely mainly on your source books and source authors. So I'll speak briefly about, for basically to understand Dr. Boger, I'll speak briefly about Dr. Boger and his contributions before I move on to his views regarding a host of topics. So basically, Dr. Cyrus Maxwell Boger was an American homeopath of German origin. He was born in Annville, Western Pennsylvania, on 13th May 1861. It is interesting to note that he was a contemporary to Dr. Chetty Ken. Means two people were having the same, belong to the same era. He died on 2nd September 1935 at the age of 74 years. And in those 74, in that time he practiced homeopathy, he has given us a tremendous amount of things to work on. What is also interesting of Dr. Boger, his presence was in an era before the decline of homeopathy across the globe, before antibiotics came into the picture. Probably his link, he is someone he will link to the pre-antibiotic era to us, the homeopathic concepts of the masters. So amongst many contributions were systematic alphabetical repertory of homeopathic remedies, Boger synoptic key, BBCR, time of remedies and wound phases, studies in therapeutics of healing, and many articles published in Homeopathic Recorder and American Homeopathic Association. Now, amongst all these books, if you want to actually understand, you have to read the articles of the authors. You have to go through their clinical cases. You have to actually see the discussions, because at the end of articles, there is a discussion. And this is where you will actually try to understand how they thought. And I realized one thing. One of the myths that circulated about Dr. Boger was he was a pathological prescriber. That, along with Dr. Bonninghausen, well, can prescribe on mind, which is, both of this are complete myths. The more you read about Dr. Ken, the more you read about Dr. Boger, you will actually understand how grounded they were in the prescriptions. There was nothing fancy, there was nothing thematic, there was nothing, just pure patient, the symptoms, finding the common strands, and the materia medica. It was very clear. If you notice, earlier speaker, Dr. Abhishek, spoke about this at length through his cases. Now, if you were to classify Dr. Boger's work, this I have taken from collected writings of Dr. Boger's collected writings, is that you will find all his works divided among this 10, what I call as the 10 pillars of Dr. Boger. His views on general philosophy, then you have got his views of case taking, his views on therapeutics, yes, his views on symptoms, the simillimum, the repertory, the materia medica, the studies of various remedies, and miscellaneous cases, including confirmation and scattered gems. So it is very difficult for me to speak about all of these things right now, but I'll just take one part of it, and I will put forth with what understanding and philosophy he has given with regards to materia medica, because that is the most practical aspect of our practice. We don't usually refer to organon when things go wrong, but we refer to materia medicas. But what has happened over a period of time with the advent of the computer repertories and ease of repertorization, we just get a pool of symptoms, something in Hindi local language खिचड़ी बना लेते हैं, उसके बाद जो भी whatever remedy that comes first, we take that and we prescribe. Or we go to the two to three remedies which come common, and most of them are like most of the polycrest taking from sources which have got a lot of rubrics. So you get this pool only of a certain set of remedies which we prescribe on, without even understanding what has to be taken. Again, aphorism number 3, the most important aphorism in homeopathic organ. So basically, I will speak about philosophy behind Materia Medica and Dr. Boger. Now, this is interesting. One of the articles I went through was in studies in the philosophy of healing, including the study of Materia Medica and taking the case by Dr. C.M. Boger. He has written, our pathogenesis, in spite of showing many features due to provers, idiosyncrasies, the translators, command of idioms, clinical interpretations, and misinterpretation, are nevertheless excellent resumes which place the keynotes in their true light as points of departure only for their abuse, and it distorts the nature's image, often brings disaster, which ends in skepticism and mongolism. Now I will again take you back to the biases which I tried to put forth to you. This is what he speaks about. A concise view not only includes the time and order of symptoms arise, but also things which modify them, the modalities. Now, the next line is very important, and we will understand what made Dr. Boger write a lot for the philosophy behind BBCR. Bonninghausen saw and corrected the tendency of homeopathy to pay too much attention to subjective sensations, while it lacked the firm support of etiological factors and modalities, which afford so many objective and distinctly certain criteria. This is where the concept of biases again comes into play. Our prescriptions should, most of our prescriptions should be based on objective and distinctly certain criteria. So I'll take you forward to his views on presentation in marking, in basically in provings. It's a typo. In making provings a definite and systemic methods should be followed in order that the finished work may be by its symmetry appealed to the trained mind. What happens is that when you open a source book, say we open chronic diseases, or Materia Medica Pura, or we open T.F. Allen's work, most of us, including myself, will actually go to sleep looking at the whole plethora of symptoms, not understanding, because we haven't been trained to do that. So basically not understanding what to read and how to read. The most important aspect is how to read. So in making provings, a definite and systemic method should be followed in order that the finished work may, by its symmetry, appeal to the trained mind as something in itself, the result of care and thorough. As a suggestion, I will illustrate the manner with a rough diagram I'll show in the next slide, intended as a guide by which the symptoms may be systemized for study, or it may be used as a guide in following analytical study of a case through repertories. He doesn't say the study of symptoms through repertories. He says about study of a case through repertories. Okay. This is again from an article by Dr. C.M. Boger. It's not there in your books that we normally read about Boger. Basically, I've just put because it was very difficult for me to actually draw. If you notice it, you will understand how systematic and how precise he was. He has divided the symptoms into objective and subjective. He has spoken about general symptoms as increased or exaggerated action and decreased or impeded function. Okay. In one of the other articles, he goes on to say, even if you know what kind of a patient, what kind of an action you are dealing with, what do you want from a remedy in this patient, you will actually understand what kind of remedies you want. Okay. Then there comes a special, that the location, sensation, sides of the body, direction, interior, exterior. Then you have right, upper, left, lower. Then modality versus condition. You have got aggravation and aberration, which we all know of. Then there's periodicity, and then he has put emphasis on pyrexia. Okay, he has in a lot of places followed this. Now, this is how he intends us to organize the symptoms of our flu. That's a huge work. So it may appeal to you when you look at it, you will feel that you have understood something from the proofings. We in our college days, usually, most of us don't look at our source books. We take those 1 or 2 books, pass the exam, and we feel that we have given materia medica. Most of us do that. And because the study of provings, how the books should be opened, what the author says, what is the philosophy behind what the author says are very important. So you get a lot of books nowadays that put all the symptoms and all the in one place without any philosophical guideline. Then he says one of his articles that it is an article, a materia medica study by Dr. C.M. Boger. We are searching today for the golden key which will unlock the gates to a clearer idea, more facile comprehension of a larger symptomatology. Many minds have traversed these paths and found methods more or less useful for a purpose. The method at once comprehensible and accurate is yet to be shown. I think he must have written this article before Boger synoptic key. All actions become simplified as they approach perfection. This holds true for the analysis for symptomatology. This holds true for everything in life, basically. If you want to see with a very philosophical thing, as you approach perfection, you say no to a lot of things. Life simplifies. Same way, it's the same about our materia medica, that over a period of the books, the authors, the philosophies, it actually simplifies. And so in the same article, he has written about this, that the symptomatology should be analyzed with regards to general. There's an entire article. I've just given you little snippets because of the time or whatever. Basically, generalities where they will be exalted or depressed. This is very, he has paid a lot of importance to this. He spoke about something like probably exalted like Nafswamika versus remedy like probably acid phos or bryonia. Then modalities, temperature, circumstances, locality, organ, combined organs. Look at the what he has written over here, or combined organs. Why he has said? Because certain remedies will affect a certain seat of action. Even that is characteristic. A lot of people say that pathology and everything is not important. But pathology is important to understand where the seat of action of the individual is. A certain and what is the pathogenesis in that organs. If we fail to understand all these things, this has to be done by us physicians. Again, take you to aphorism 3, where he speaks about knowledge of the disease and what is to be taken in that disease. Organ on aphorism 3. So he speaks about a concrete example for which I have just because of my main emphasis was making you understand how the materia medica and how he looked at materia medica, Dr. C.M. Boger. Now we see from the provings, he has just come to this 4 things. Earlier, it was with a huge, large pictorial diagram that I had shown. And now he has come only to this. So he is trying to make it simple for you. Okay, so basically, the most important work that at least we get our hands on of Dr. C.M. Boger is the synoptic key of materia medica. There is another work which is there, which is general analysis, and which is a very small booklet that is there. And since most of us don't get that, it's not, I don't think it's published anymore, but it's a very small booklet called as general analysis. So speaking about Boger synoptic key of materia medica, I hope you guys have understood how the philosophy of Dr. Boger, or the thinking of Dr. Boger into coming down and distilling the Materia Medica came about. So first of all, I would like to say Boger Synoptic is the most undervalued book, because most of the time when we open Boger Synoptic key, because of our bias that a Materia Medica should be like general section, then our mind, head, it doesn't fit into our preconceived notion or a bias of how a Materia Medica should look like. Same thing goes for provings. Okay, so it is one of the most undervalued book because of our failure to understand the philosophy behind this book. What I have done is I have worked on the philosophy of, if Dr. Boger A in the successful practice could use this book with great success, why can't we? So basically, fail to understand how the book we should use, and we should be honest to ourselves about all those things. Secondly, from the above, you can see he wanted to present the homeopathic Materia Medica in a more concise, intuitive, yet a simple format. He spoke about perfection. At the same time, he spoke about simplification. Okay. He spoke about simplification of the Materia Medica. He starts with provings and he comes that these are the important things. He spoke about simplification of the Materia Medica. Now, the name itself of the book indicates its purpose. The book's name is Boger Synoptic Key to the Materia Medica. It is not Boger's Materia Medica. It is not Boger Boninghoffen's Materia Medica. It is just Boger Synoptic Key to the Materia Medica. In an earlier article, he speaks about we are searching for the golden key which will unlock the gates to the Materia Medica, vast Materia Medica. So my takeaway from this, what I've understood, is that Boger Synoptic Key is not supposed to be a complete Materia Medica. In fact, I somewhere, now this is my bias, believe that it is not supposed to be used as a standalone or even like a Materia Medica. Although symptoms are there, everything is there in the book, but we are not supposed to be used it like a Materia Medica. It's not supposed to be used like a standalone repertory. Now I'll come to that point. When you look at the repertory of Dr. Boger, we see very few symptoms and very few remedies. At the other end, during the same era, we have someone like Dr. Kent's repertory, which has another history altogether. We see a plethora of rubrics, plethora of symptoms. Hello. At the same time, we see about another repertory published by the same master, BBCR, which has again got a lot of chapters and a lot of symptoms and a lot of remedies. But why Boger Synoptic Key is a small one? Because it's not supposed to be used that way. So basically, its main purpose is that the strain which runs through every pathogenetic symptom complex has been called the genius of the drug. To give this a proper place in our prescription should be the ideal of every prescriber. To this end, the book is written. This is a foreword in Boger Synoptic Key. He further writes, the repertory is only intended to orient the searcher. It's not supposed to be used like a repertory. It doesn't have anything. It's just supposed to orient you. So we come a little thing. We'll speak about a little bit of Boger Synoptic Key. Is that it was by Dr. Cyrus Maxwell Boger. It is divided into 3 parts. We all know it. Analysis, a short repertory he has given. He has given a synopsis and exposition of the important and characteristic feature of the most important remedies of the homeopathic Materia Medica with their philosophy, physiological spheres of activity, modalities, and relationships. Here you can actually see what he intended to. And he has given a table of approximate duration of remedies, complementary remedies, antagonistic remedy, and supplementary reference table in the 3rd section, which is a valuable additional table for reference to the repertory portion in the text. The supplementary reference table has been enlarged considerably, he says, by transferring most of the comparisons to it from the text of respective remedies. They're supposed to be separate. Then certain editions are combined, by the way. I have read through many editions of BSK. This makes clearness and a facility for reference. He's very clear with that book, what he intends to do with that book. Now, before I take you a step ahead, I just like to point out in one of the cases with the earlier speaker, this can clearly be seen of the strain which runs through every pathogenic symptom complex, where the cough aggravated by motion, the emerging tendency, everything was a pathologic strain, pathogenic symptom. Pathogenic to whom? To the patient and to our materia medica. This is the beauty of Boger synoptic key. This is the beauty of his prescriptions. No, only objectivity. No, nothing like interpretation. Okay. Okay. So basically, I'll just take one remedy from that, and I'll try to make you understand how to utilize the Boger synoptic key. For that, I have chosen there are many remedies. Like my earlier I speak a lot about Naxomica, but since I wanted to learn more, I chose acid force. Now you see this as a regular how our materia medica looks like, and when you looked at it as an individual lymphocyte, it actually it just looks like a mixture of symptoms. Okay. Now, where is the first place an individual should look in a Boger synoptic key? Is this first 3 or 4 words, mind you, not a sentence, not a paragraph, but only it's a key. So like a small lever of a key, we have to look at the lever, but anyway, look at the weak or debilitated with free secretions. Now we have to take these words and we have to apply it to the sphere of action. When we apply it to the mind, we see that there is slowness. We also see that the patient is quite indifferent, apathetic, obtuse, or torpid. Then when we apply it to the nerves, we can clearly see that the nerves, he speaks about he speaks about spine, very paralytic weakness along the spine. 1 minute. How? He speaks about metabolism. He speaks about diabetes with polyuria, where there is profuseness of secretion. And then he speaks about painless diarrhea, which is also profuse. But for the you have to apply the weak or debilitated state to every part of the region. So basically, you will notice this about every remedy. Even if you take Naxomica, the first word is violent. And then you apply the Naxomica to the sphere of action. Okay, that is the first step. Then you take the modalities that are there and you apply those. And then you will come to a where to look for in the materia medica, not in the patient and the materia medica. This is not the end result. This is a key towards study and towards understanding the materia medica of the patient. Okay. So now this work of going to the key to the materia medica is massive. But as I was preparing for this lecture, one of my colleagues and friends announced, I'll just speak to you about it, announced a book. And for further reading of how to do this, I would like you to take a look at this. The book's name is Unlocking the Synoptic Key by Dr. Vaishali Bhide. And the best aspect of the book, it unlocks the vast materia of the materia medica via the synoptic key. Now, what this doctor has done is that she has taken the concepts used about what we have spoken about, how to utilize the synoptic key, and she has applied it across 11 materia medica across the 15 years of her practice. And there are zero interpretations of this book. So I asked the author to present the book and give the video, which we'll see in the next slide. If we have time, I'd like to put forth another thing. We'll see this video first.
Dr. Nikhil, volume is not there. It's not audible.
Huh?
It's not audible.
It's not audible. There's
Yeah.
no volume at all.
No.
Now is it audible?
No, the volume is so low. It's not
Volume is very
audible.
low.
Yeah.
Okay. Okay, I'll try to. Okay. I think it's making use of my mic rather than the switch. Yeah, now is it audible?
Not really.
Huh?
Volume is quite low. We can't hear
Why?
this one. Yeah. It's
Okay,
low.
we'll just.
It's not audible.
Okay. No, 1 minute. I'll try to share the original video. Let's see if I find this. Okay. 1 minute. I'll start a new share and we'll see if this works. Is the voice audible now? Hello?
No, sir. No, sir.
It's not audible at all?
Please play the video first. No, it's not audible.
Okay. And
You can share the video link with us so that we can share it with the audience in emails.
okay, I will do that. 1 minute.
Sure.
Okay. Okay. So basically, that was supposed to be my last thing before I went on to discuss. I wanted to show you basically, Dr. Vaishali Pide, what she has done is taken uh, uh, the synoptic key, and she has expanded the entire synoptic key to include the materia medica of various books. I'll share the link to the video, which can be shared later on. Okay. I now for the last part, I would like you to show, if we have time, I would like to show just one case of how Dr. Boger utilized the materia medica. Okay, I hope I'm able to. Yeah, this is basically a case by him. Is it visible?
Yes, sir.
Yeah, is this visible? The elements
Yes.
of. So basically, this is one of the articles he has written. What he has taken, he has actually worked on the case with the help of the LSMC format, which a lot of times in college we listen to, which we for exams we write, but without understanding how, since we have the advantage, or I would say disadvantage at to a certain level of computer repertorization, which we don't understand the significance behind it. So he has divided the entire life history of the patient into locality, modality, symptoms, and he has come on those basis with a reference to his material, to his synoptic key. He has come to the remedy. I'll just show it. It's a very brief. I shall just show what it is actually, and I think it should have. Okay, now is it visible?
Yes.
So basically, you can see he has come to the derivation of focus cacti from the symptoms of the patient. But very interesting is to see how he has come about it. He has put it exalted. We spoke about exalted sensibility. So he has taken the history of the patient, and then he has put that into the first column of the patient. Then, if you remember, if you recollect those small snippets, you can see the table, right?
Yes, sir.
Okay. So basically, the patient, we have seen the exalted sensibility. What he spoke in is earlier snippets which I had shown you. He has taken the modalities and he has just grouped them for comparison. Then he has taken the sensibility in which area, the location. What are the modalities in that location? And you will see same secretions increased. Sensations he has taken in that particular location. Then he has taken what is happening in that location, aversion to warmth, and how the respiratory symptoms are, especially in a warm room, aggravated morning. What are the cough paroxysm of the patient symptoms? And he has finally come to the focus cacti with the group comparison. This is not my this thing. This is actually the work of Dr. Boger. As I said, you will actually understand. And this is a case of a nephrotic syndrome, by the way. It's not a case of cough. So basically, this is what the earlier this thing spoke about going from generals and particulars, and this is what I wanted to explain about synoptic key and Boger's approach to materia medica and how to compare both of them. I hope you have taken something from what I've talked about, especially about biases, especially about learning from masters and how to proceed to learn from masters. We can't learn from all of them at one time. We have to pick someone and try to find whatever we can about that particular master. With that, I say thank you to all of you. Thank you very much and grateful to KHA.
Thank you so much, Dr. Nikhil. It was really wonderful. Thank you for sharing the beautiful work, the unique work of Dr. Bogers with us, and the importance in the in clinics of the Bogers work. Any questions from the viewers? We have one question for Dr. Abhishek from Dr. Anjali Malik. How is the deviation dose prepared?
Thanks for the question. Deviated dose, actually, I've learned from my sir, and then when I went into organon, it was actually mentioned in preparation of 50 millisimal potency, but even we applied to centesimal potency, it worked. Deviation means slightly deviated from previous potency. Like for example, say 200. So if we want to make a 201 potency, then we take a part of 200 potency and dissolve it into water, uh, approximately 4 ounces of water, then stir it properly, and then it is prepared 201 potency. So like we prepared our other potencies, we give a force of friction and shaking. So similar process, we take a part of previous potency prepared in water, then add it to distilled water in around 4 ounce, and then prepare next potency. So it is how the every deviation is prepared. The idea is to not to give a same potency again, because it has already exhausted its action. So just deviated from the previous one. And this is in later part of Master Hahnemann, he has applied use in with the centesimal, this 50 millisimal potency. But I have seen with my sir, Dr. Praful Workar, or in my practice, it is working with centesimal potency as well.
So we ask the patient to do so before ingesting?
Yes, because it should be prepared fresh.
Okay. Okay, thank you, sir. And no more questions. Any more questions from the viewers? Please write your question in the chat box. I think everything is clear, and both of you have an enlightening session. We have an enlightening session with both of you, and now we would like to take the privilege to honor both of you with KAH Appreciation Certificate. So please accept it from KAH Homeopathy Study Group. Let me share. Congratulations, Dr. Abhishek. Is it visible?
Thank you so much.
Thank you. Congratulations, Dr. Nikhil.
Thank you very much. Thank you.
Thank you for your gracious presence and for your precious time in sharing your knowledge and wisdom. And heartfelt thanks to our viewers and followers to join us today. We have many such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. And for the upcoming webinar info or any other updates, follow our social media handles on Facebook, Instagram, Twitter. If you missed any of the webinar, you can watch it out at our YouTube channel with the name Dr. Kavita Kukunur. And I'm also thankful to our KAH volunteers for their continuous support and selfless services with which we are able to organize these webinars in successful manner. And for any other info, reach us at kahstudygroup@gmail.com. And please don't forget to fill the jot form, which I have shared in the chat box. See you all in the next webinar. So shall we end, sir?
Definitely. And I'll share the video in the card or the link to the video.
Yeah. Okay, sir. We will
Because
share that
book is,
video, the
very
viewers,
good.
in the emails. Yeah. Thank you all for joining. Thank you. Good night.